Good afternoon and welcome. My name is Melissa Latham, and I'm the Director of Communications and Policy at CDFA. Thank you so much for joining us today for the Rural Community Health Infrastructure webinar. We are recording today's session and we'll share it along with the presentation and relevant materials in the coming days. We do anticipate today's presentation will run from now until about 3:30. That does include time for questions, so please post questions in the Q&A box. We will be monitoring that throughout today's webinar and be pausing to answer those questions. As you can see here, today we're going to cover a number of topics, including an overview of the Federal Rural Health Transformation and Go North program, a brief overview of CDFA and the resources we have available, and then we'll dive into the Rural Community Health Infrastructure program, including a focus on budget period 1 and the eligible entities and activities within that period. We'll give you an understanding of CDFA's grants management system where you would apply for these resources, and then walk you through the request for eligibility determination process and form. Throughout today's presentation, you're going to hear from my colleagues Katie Easterly Marte, Rebecca Bovair, and Nate Olson, as well as a representative of Go North. So it is now my pleasure to introduce you to Whitney Hammond, Director of Transformation with the Governor's Office of New Opportunities and Rural Transformation Health, also referred to as Go North. So Whitney, welcome. Thank you so much for joining us today, and I'll now turn it over to you to share a little bit more about the federal program and our state initiatives.
Sure, thank you. So hello, everyone. I'm Whitney Hammond, the Director of Transformation at Go North, and I'm just going to talk a little bit about how we got to where we are today. On the next slide, this is just to give a little context. If anybody has not already heard about the Rural Health Transformation Program, don't worry about it. You will moving forward. I was just down in DC yesterday at the second annual RHT Summit, and we were reflecting on that it's actually been about a year since this program was authorized at the federal level. So it was July 4th last year that it was put into statute and established that there was a rural health transformation program, and that would be administered by the Centers for Medicare and Medicaid Services, or CMS. And in statute, it really set specific timelines for the federal agencies and state agencies to really move quickly to invest this funding in rural communities across the U.S. So I'm going to talk a little bit about the federal funding and the goals and features of the federal funding, and then I'll talk about how New Hampshire is approaching it. So at a federal level, they had 5 strategic goals that CMS really wanted states to be focusing on. So there was what they called Make Rural America Healthy Again. I think of that as a lot of what we call population health, or just kind of getting upstream and focusing on prevention and healthy lifestyles and physical activity and nutrition security. So lots of the things in the community that just help people stay healthy. And then there was a focus on sustainable access in rural health care, which is really about just investing in rural healthcare providers to make sure that they're sustainable, and really, like, during this period of an enormous amount of pressure from changes to things like Medicaid eligibility and other major health policy changes that are coming down the pipe. There was a big focus on workforce development and just making sure that we continue to be able to staff rural healthcare in the country. Huge emphasis on these last 2 goals, which are innovative care models. So at the conference I was at, we were learning about some states are using robots for OB or drones for delivering pharmacy. So there was a big emphasis, and you got scored really well if you proposed innovative care. And then a large focus also on tech innovation. So tech at an organizational level, tech at like a state level, creating interoperability between systems using tech. So it was just a large emphasis in the grant. Key features of the transformation program are that it's really state-led. So this is a grant where New Hampshire got to really say, this is how we are going to do it. We got to come up with a lot of the details, And we took what we call a bottom-up approach, where we got lots and lots of inputs through a request for information process back in August, where I'm sure a number of you submitted initiatives to the Department of Health and Human Services, who then created the New Hampshire Rural Health Transformation Plan. Other key features is this is not intended to be a program that's reauthorized after the 5 years of funding. So it's really intended to be what they call catalytic funding, or time limited investments that are transformative and sustainable. So that kind of gets to those other features under the box of features, and then just that there's a lot of emphasis on providing technical assistance to rural communities as they're going through their transformation efforts. So now on the next slide, I'll start to talk about New Hampshire's approach. So not surprisingly, the goals that I just went over for the key goals from the federal program are very well aligned with the key goals for New Hampshire's application. I just, again, was down at a summit, and I heard a lot of states, some states have up to 27 initiatives. So New Hampshire was pretty modest, and we did 5, but there's a lot within those initiatives. So there are 44 different projects under the 5 initiatives. So again, we've got our population health, or the preventive stuff, community-based care, build out the rural healthcare access, our workforce recruitment and retention, tech, and then financial solvency, which I think a lot of projects that are going to come from this funding opportunity will probably link to financial solvency, but it's also great if they're going to link to other initiatives like healthcare access or pop health, or even just implementing tech solutions. So next slide. All right, so just for anybody who's interested, the way we're doing the rollout in New Hampshire is we've created these 5 hub contracts, and those hubs have fairly large investments of the rural health transformation funding. And then the intent is that they will then distribute additional funding into the local communities, but that they'll do so in a way that provides a lot of technical assistance and support to help people to navigate some of the grant requirements and other pieces of the puzzle that, can be fairly complicated. So we have our one hub is the CDFA, and they're really doing capital investments that again help to implement the plan and all of those initiatives. We have the Foundation for Healthy Communities, that's probably the largest hub and the most diverse, but has a lot of investments around access. So there'll be funding opportunities for EMS, hospitals, rural hospitals, federally qualified health centers. So a lot of the kind of healthcare access. And then 2 of our hubs are really focused on workforce. So we have the University System of New Hampshire and Community College System of New Hampshire that are doing kind of a combination of creating more and more slots and opportunities for people to get trained in healthcare professions, and then also really expanding our mobile SIM capacity to be able to train in rural communities and upskill the workforce. And then the last hub is the Community Behavioral Health Association, and they're really working across the community mental health centers in New Hampshire to make a pretty large investment in shifting them into what are called certified community behavioral health centers. And there'll be capital investments related to that transition and certification as well. So 60% of the total award that we have for this budget period is in those 5 hub contracts. And then the other 40% is still at Go North. That does not mean Go North is using 40% of the funds to support our team, but we're just actively developing additional procurements for other pieces of the Rural Health Transformation Plan. And you can go to our website and see any of our procurements and a little bit of a forecast of upcoming procurements as well. So I think the next slide is just giving the context of so there are so many definitions of rural. In the case of this grant, we were given a little bit of flexibility in how New Hampshire wanted to define rural. And so we chose the most inclusive definition that we were really allowed to. So on the map, you'll see green communities or census tracts that meet this federal definition of being rural, which you can find on the HRSA website if you want to know the real nitty gritty. But basically, these communities in green are considered rural, but then we also have locations that just by the definition of what they do and who they are, also can be qualified as rural. So those are the little pinpoints on the map of the four different, symbols. And you'll see that there are some symbols in the non-green shaded communities. And so again, like we have said to CMS, we want to include those pinpoints as eligible for investments of the Rural Health Transformation Funds. So that is a very high level overview. Again, gonorth.nh.gov is our website, and there's all sorts of information, including the state's application. So I encourage people to go there if you want to learn more. And then I will hand things over to Katie to talk through what CDFA is doing for rural health transformation.
Thank you so much, Whitney. I'm Katie Easterly Marte, the Director of the Community Development Finance Authority, and we're a statewide community and economic development entity. We serve all of New Hampshire. We're state chartered, we're independent, and we're a nonprofit organization. We're set up very similar to other state authorities like the New Hampshire Housing or the Business Finance Authority. And that setup allows the board of our organization to be appointed by the governor and council. During this portion of our presentation, my goal is to provide you an overview of CDFA, describe our funding and technical assistance ecosystem, and provide some examples of how our funding impacts New Hampshire communities. We serve all of New Hampshire, and we see a future New Hampshire whose communities are economically and socially resilient, reflect and respect their natural surroundings, and are places where people want to live, work, and play. Our overall mission is to meet the evolving community and economic development needs of New Hampshire. And to do so, we approach our work with integrity, we prioritize collaboration, we strive to be adaptable to changing needs and issues, we respect people in place, and we make focus investments that provide prosperity for all. In state fiscal year 25, CDFA made 69 different targeted investments in community-based projects, and you can see them across the state here and the various programs that those investments were made. This yielded measurable outcomes in our state, and it engaged donors in these important revitalization projects. We had 160 unique business donors investing in these projects through CDFA's tax credit program, which many of you likely have been involved in. To support community economic development, we provide a variety of financial resources, which you can see in this ecosystem. It includes the competitive deployment of grants, loans, and tax credit equity. And that investment goes from concept initiation, where an idea is just starting to come together, planning and development, where you're really pulling together the plans for the specific project that will be developed. And then the majority of our resources are in that implementation phase. Our impact is seen in revitalized downtowns, high-quality childcare facilities, renovated affordable housing, clean energy projects, business expansion to provide jobs, and a healthy and vibrant nonprofit sector. In partnership with Go North, CDFA is using this capacity to invest in projects across New Hampshire and administering a capital expenditure program, which will invest funds into projects that improve buildings and infrastructure across New Hampshire. The Go North plan aims to improve buildings and infrastructure as part of an overarching strategy, which Whitney talked about, which fundamentally rethinks how care is delivered, coordinated, and sustained across rural communities. It's not a single program, it's a system-wide effort that depends on strong execution and deep collaboration across providers, communities, and implementing partners. And CDFA's history in working with so many community partners, from businesses to municipalities to nonprofits, really positions us to support you in doing this work. As the Rural Health Infrastructure Program develops, CDFA has already drawn on a range of data resources to understand the rural health landscape in New Hampshire and ensure the program is grounded in community conditions and connected to the Go North plan. These sources have informed our work, and at the center of it is CDFA's community progress indicators. For more than 5 years, CDFA has been pulling 13 unique metrics in each of our 234 municipalities. These 13 metrics for each of our communities assess social economic well-being and community need at the municipal level. We call it the CPI, and the CPI, Community Progress Indicators, help us understand where the greatest needs are and guides how we can support resource investment. It draws on data from sources including the US Census Bureau, New Hampshire Health and Human Services, New Hampshire Housing, and other state and federal agencies. All of this data paints a picture of where the gaps in rural health access and capacity are most acute. This grounding in data is what allows us to design a program that responds to the needs and meets the objectives of CMS and the Go North program. The Go North plan is a 5-year plan and funding. In budget period 1, CDFA will invest funds in Go North plan aligned projects, which also allow the state to meet the expenditure deadlines with CMS's deadlines. The Rural Community Health Infrastructure Program for budget period 1, administered by CDFA, is a key piece of this broader strategy, as it's a competitive grant program and it will fund targeted renovation projects that strengthen the spaces where care is delivered. Its impact will depend not only on your applications, but our ability to connect you with technical assistance and to ensure your projects are successful and on time. We want to have a strong collaboration between applicants, state agencies, and hubs, both the CDFA as a hub and also the 5 other hubs. And that will ensure that we have successful projects from that concept initiation phase all the way to completion. CDFA will continue to work across the state and community partners to look at data to shape the future budget period investment programs. If you're not eligible for the budget period 1 program, but your work aligns with Go North's plan, please stay connected to CDFA and to this work. You may be eligible for a future budget year program. I would now like to introduce CDFA's Director of Community Development, Rebecca Bover, who will walk you through the next step of this presentation. And before I do so, before I hand it to her, I'll just be sure to answer any questions that may have come up.
No specific questions to that section, but just encourage folks with looking for information about Go North to visit their website, as Whitney indicated, as there are a lot of materials and resources there for you to explore about how they're approaching New Hampshire's plan.
Thank you so much. I'll turn it.
Thank you. Hi, everyone. My name is Rebecca Bover. I'm the Director of Community Development, and I am going to walk you through our CDFA's Rural Community Health Infrastructure Program. So hopefully answering, what exactly is this program, which we also call RCHIP. It's a competitive grant program administered by the CDFA on behalf of Go North that is investing in the physical infrastructure of healthcare facilities. So this is through investment in minor renovations and targeted capital improvements. This is not for new construction and not currently for equipment purchases. The focus is on improving the built environment so that healthcare providers can expand their capacity to deliver better care to more people in New Hampshire. I will discuss the award parameters by entity type in a few slides. First, in the first program year, we're really focused on expanding service capacity in our communities, reducing barriers to care, and supporting integration across primary care, behavioral health, and long-term care. So funding will also support the adoption of telehealth, data systems, and team-based care models. Applicants to RCHIP should consider how their proposed infrastructure investment advances one or more of these priorities. Those projects that can clearly connect their proposed renovation to measurable improvements in capacity, access, or care coordination will be most competitive. For budget period 1, there are 4 priority entity types: federally qualified health centers and lookalike, community mental health centers, EMS providers, and county-run nursing homes and assisted living facilities. In this first program year, funding decisions will be based entirely on entity type and not by location. These entities were selected based on their direct alignment with the Go North program priorities and their capacity to absorb capital investment within the program timeline. Childcare investments are also eligible, either as a standalone project or as part of a broader renovation, when the childcare is on the site of or operated by one of these entity types. and directly support childcare capacity for healthcare workers. I think the key phrase on this slide is measurable improvements in access, capacity, and healthcare coordination, because that's the lens through which we'll be kind of reviewing applicants to the program. Okay, next slide. So within each entity type during budget period 1, not all projects are equally competitive. We've organized investments into 3 tiers. We're calling them high priority, moderate priority, and lower priority. High priority investments most directly advance the goals of the first program year and will be most competitive in scoring. Moderate and lower priority investments may still be considered depending on available funding in that round, but they'll need to make a stronger case for why our CHIP is the right fit. Lower priority investments that apply to all entities includes technological investments and sustainability improvements, like including energy efficiency. It doesn't mean these aren't important investments, but they're just for this program right now not considered, or they are considered lower priority for the purposes of the funding. So now the next 5 slides, I'm going to walk you through each entity type and what falls into each tier. So starting with federally qualified health centers and the lookalike, high priority investments are those that expand clinical capacity within existing facilities. This includes adding exam rooms, maybe reconfiguring space for dental or behavioral health services, or creating telehealth-enabled care rooms. The emphasis is on doing more with what you already have, not building new. Workforce support spaces and technology infrastructure tied to care delivery are considered moderate priority for this. And for higher priority consideration, the renovation project needs to directly increase the number or types of patients served. Moving on to community mental health centers, the highest priority investments focus on integrated care delivery and crisis response. This means space that supports co-location of behavioral health and primary care services, crisis stabilization environments, and infrastructure aligned with certified community behavioral health clinic service delivery models. Go North's plan places significant emphasis on behavioral health integration, so projects that directly enable that integration will be of higher priority for funding. County-run nursing homes and assisted living facilities are a critical piece of the rural health system, specifically because they absorb patients who need post-acute or long-term care but can't, safely remain in the hospital. When these facilities can't accept patients due to capacity or infrastructure limitations, it really creates a bottleneck that backs up throughout the entire system. So high priority investments are those that restore bed capacity, maybe reconfigure space for transitional or short-term rehabilitation care, or improve patient flow and discharge planning. The maximum award for county facilities is calculated as up to 50% of the budget period 1 RCHIP award, reflecting the scale of investment these facilities often need. EMS providers in rural areas also face a unique infrastructure challenge, as their ability to support a community depends heavily on where their stations are located and how well equipped those stations are, and whether the crew can be ready to respond when needed. So high priority investments are those that improve geographic coverage, reduce response times, or better support crew readiness. This may mean renovating a station to add overnight sleeping quarters, improving vehicle housing and staging, or co-locating multiple EMS providers. The maximum award for EMS is $2 million, with a minimum of $25,000, a wide range that does reflect the real variation in EMS infrastructure needs across our state. And finally, childcare. Childcare is a category within RCHIP specifically because it supports the healthcare workforce. When healthcare workers can't access reliable, affordable childcare, as we all know, it directly affects their ability to work, creating a workforce access problem that affects patient care. So childcare investments in this program year are eligible when they are tied to a qualified health entity on the site of or operated by a federally qualified health center, community mental health center, or county nursing home or assisted living facility. These can be standalone projects or embedded in a broader renovation as long as they meet the entity requirement. So the maximum award is up to $2 million, and it's also based on the number of licensed childcare slots the project will create or support. So that was a lot, running through all of the entities and their priority areas. So I think we're going to pause here if anyone has any questions.
We do have a number of questions coming through in the Q&A box, so thank you very much for those. There is one around how we're defining or how health is defined. Does it include social determinants of health? Is that a factor in how we're looking at health?
I might ask Katie to come back to help kind of answer this question yeah, thanks.
Social determinants of health are definitely part of the Go North plan. So that upstream kind of investment to really improve health access and health outcomes. I will put a link to the plan, the Go North plan in the answer, and you'll be able to see those connections to social determinants of health. Thanks for the question.
Great. We also have a note that will the nursing home bed moratorium be considered when reviewing applications? Some county facilities may not be able to expand the number of beds.
So we're still working through our what the application will look like and what some of those requirements will look like, how we're going to our scoring metrics. So I don't have an answer for that right now, but I appreciate the question, and that's something that we will be looking to develop. Like I said, as we develop that guidance, it's something that's in process at the moment.
Great. And then a question for clarification on the amount that will be designated towards state nursing homes in 1 year. Is that going to be approximately 20 million of the about $40 million we have to administer, or is there another number we should mention?
It's up to 50% of our available RCHIP award for program year one. So yes, I think we have technically 40.5 million. So it is up to 20.25 million.
So that would be based on eligibility and eligible activities.
Yes, there's a lot that will go into that, but that is the award amount that is possible.
Thank you. Would healthcare centers that provide reproductive health care be eligible? Are there any program areas that are not allowed or cannot be co-located within these entities seeking funding?
Um, I think as long as you are one of these recognized entities, we don't have specific guidance around the programs that are offered. And I don't know if Katie has different thoughts on this, but this is something that we will be, again, we are specifically focused on the needs of these entities and for program year one. Program year 2 through 5, things will change. The guidance will develop as we go and we learn about, I think, the needs of our communities and the needs of these entities. So I don't have a good response for you, but I don't know if Katie wants to weigh in on this, but I think I'll look for her to. You want to add anything?
No, as you said, Rebecca,
Okay.
standalone health centers providing reproductive care are not eligible in year one just because they aren't a federally qualified health center. But those services embedded in a federally qualified health center, renovations to spaces that provide those services would be eligible. And then it's possible as we look into budget period 2 and beyond that those entities would be eligible individually.
We have a question around childcare. If it's a new program within an existing approved facility, could that qualify potentially?
I think as long as it's within one of these specific entities, then yes, it would qualify. So it has to be on site or operated by the entities that I mentioned. It can't be a standalone that is unaffiliated with one of these entities.
Okay. We also have some notes around some pretty specific questions for eligibility. So I'll just probably have us move through to the next section just so that we make sure we have enough time to get through all the content that we have today. But please do continue to post questions and we'll answer them throughout the rest of the presentation.
Great. Okay, so we're going to move now to discuss awards by entity. So this slide shows the award parameters across all of our entity types. So as I've alluded to in previous slides already, but maximum awards range from $2 million for EMS and childcare up to $5 million for federally qualified health centers and community mental health centers. The minimum award is $100,000, as you'll see, for most entity types, and $25,000 for EMS. Those are the minimums. All projects must involve minor renovations or targeted facility upgrades within the existing structures. Again, this is not for new construction or major expansions. Furniture, fixtures, and equipment are not eligible for RCHIP funding, but we do encourage you to flag those needs in your application and include a budget for it, as we want to know what those needs are, and we will work with you to potentially identify other resources through the other Go North hubs if they're available to support those needs. And for county-run nursing homes, like we just said, the maximum award is calculated as up to 50% of the available RCHIP funding during the first program year. But as Melissa noted too, that there are other eligibility requirements that will be considered when we're considering all of these awards. Okay, next slide. Compliance requirements. So all RCHIP awards are subject to federal requirements. This does include 2 CFR Part 200, the Uniform Guidance, which governs how federal grant funds are managed, covers procurement, financial management, record keeping, and single audit requirements. I'm sure if you've previously, received federal grants, you're very familiar with this. Second, Davis-Bacon is required because RCHIP funds construction and renovation work. Prevailing wage requirements do apply. So your contractors will need to submit weekly certified payrolls for all covered construction work. And third, there is a summary environmental review required. There is not a full environmental review, but every awarded project will be required to complete an environmental checklist at the time of award and before construction begins that covers things like asbestos, air quality permits, and water discharge. I think it's really worth noting or emphasizing that Build America, Buy America requirements do not apply to RCHIP. But CDFA will provide full guidance on all of these requirements at the time of award. I think we're a little bit ahead in sharing that, but I think it's important for you to know what's involved. So the application process really is 2 steps. So step 1 is the request for eligibility determination. We're calling it the RED for short. So this is a concise, high-level overview of your project that allows CDFA and Go North to confirm that your organization and project are eligible before you invest time in a full application. So REDs will be reviewed on a rolling basis throughout all of our funding years. If your RED is approved by Go North, you will be invited to submit a full application. The RED must be completed in our grant management system, which we're going to go over in a minute. Step 2 is the full application. So that will go into much greater detail on project scope, budget, expected outcomes, etc. Full applications will be reviewed and scored by CDFA. Then CDFA will make recommendations to Go North and CMS, who will issue final approvals. Throughout this process, CDFA will provide extensive technical assistance. We will provide workshops like the one you're attending today, one-on-one support, and something we call pre-application meetings. They are not available now, but after, if you were approved through the request for eligibility determination, after you complete that form, if you receive approval, we will be offering pre-application meetings where you will have an opportunity to sign up with our program team to discuss questions you may have regarding the application process. We will also provide financial assistance for project development and grant writing, which I'm going to discuss in a later slide. But this assistance is also available through the RED form. It's optional. However, we strongly encourage applicants to take advantage of these resources. Next slide. So this is the full timeline for the first program year. So funding was approved in March, and the request for eligibility determination, again, the RED form, will open next week in our grant management system. We do have 2 more webinars coming up, another program overview on June 25th, followed by an application process webinar on June 30th. We'll run through in great detail what the application looks like, the scoring requirements, eligibility requirements. The full application opens July 1, again, for applicants who have an approved red form, once eligibility is confirmed. And then again, the deadline for the applications is September 1st. Award recommendations are expected in October, pending Go North and CMS final approval. So I'm going to stop and pause there again if there's any questions about that. And then I don't know if there's.
I think we've answered a number of questions that were pending. I don't see any open questions right now, but imagine as the information percolates in folks' minds, please do continue to drop questions into that Q&A box, as there'll be other opportunities. Oh, we just had one pop in that you might be able to answer is, when are funds to be spent by?
So for the first year, funds need to be spent by September 30th, 2027 is our expenditure deadlines. For the budget period. However, all awarded projects do have from November 1st forward have 23 months to complete their project. And so if awarded, there'll be awards will be provided through a claims process, a reimbursement process. So you do have 23 months in most cases to complete your project. Hopefully I'm answering your question. So now, is that, Melissa, I don't know if there's any other open ones.
That's all for now. Thanks.
Okay. I'm going to introduce Nate Olson. He's our data and compliance specialist, and he's going to walk you through our grant management system so you know how to register and complete our eligibility form.
Thanks, Rebecca. As Rebecca said, my name is Nate Olson, and I support the CDFA with their grants management system. Today, I'm going to walk you through how to actually submit your request for eligibility determination form to the CDFA so we can review it. Everything you do with us, from setting up your account to submitting your determination request, happens inside of CDFA's grant management system. We call it GMS for short. This system lives online at nhcdfagrants.org, and it's the system your request for eligibility determination, potential application, and grant activity will all run through. This is the same system that CDFA uses for all of our funding opportunities. So if you've applied for or been awarded CDFA funding in the past, you've been exposed to this system. Over the next few slides, I'll take you through the system start to finish. So by the end, you'll know exactly how to get registered and how to submit your RED. None of this is complicated, but there are a couple of spots where people sometimes get tripped up. So I want to point those out as we go along. Getting started really comes down to two steps. First, you're going to need to register for an account. And second, you'll be using that account to submit your RED. You can't do anything in the system until you have a login. So registration is what we're going to walk through first. You'll create your account at nhcdfagrants.org. Our staff is going to review it and approve it. And then you get a user ID and password via email. Every individual should have their own GMS account. So if multiple people in your organization are working on developing your RED in our system, then they should each register. Once registered, you'll be able to open the funding opportunity and complete your request for eligibility determination. And I'll walk you through both of these in detail. The one thing I want you to hear right now is that registration isn't instant. A CDFA staff member reviews each registration and has to approve it manually. So getting registered or starting the registration process as soon as possible is very important. So now we'll walk through the registration step by step. Once you're at nhcdfagrants.org, you're going to click the yellow button that says click here to register. That opens the registration form where you'll fill in your details, your organization's details, and your authorized official information. Anything required shows up in red with an asterisk next to it. And once you're done, you'll click save registration information at the bottom, and that sends the form in to us. From there, our staff will review your registration and get things set up on the back end before approving. Once you're approved, you'll get two separate emails, one with your user ID and one with your password. Those two together are what you're going to use to log in. So on the next slide, we'll look at what the user registration form is actually going to ask you for, so you can have it ready. The first part is about you, why you're registering, your name, email address, phone number. The second part is about your organization, its name, type, address, tax ID or UEID number if you have one. And the last part is your authorized official, their name and email address. The authorized official is the person who has authority to approve the submission of a grant application and legally enter into a contractual agreement on behalf of the organization or municipality. The AO for a nonprofit may be the executive director, chief executive officer, a department head, board officer, or another high-level team member. The AO for a municipality may be a town city representative, such as town manager, town finance representative, select board, or someone who has been given such authority. If you get stuck anywhere on this form, Felicity Winters is your contact, and her email is right here on the slide. Remember, registration is approved manually by CDFA staff and can take up to 2 business days. So register as early as possible to maximize the time you have to complete your RED and get your application. Once you're registered and approved, you will be able to log in. So you'll log in from that same site that we use to register, nhcdfagrants.org. You'll enter the user ID and password from those 2 approval emails and click login. The most common mistake we see here is people trying to log in using their email address as the user ID. Your user ID is not going to be an email address. It's going to get assigned to you and comes in through your approval email. So use what's sent in that approval email as your user ID, as well as password, and you should be good to go. If you're still having trouble getting in, look for the Forgot User ID and Reset Password buttons on the login screen. Those should clear up most login problems on their own. And if that doesn't get you where you need to be, Felicity again can be reached out to support with any registration or login issues. Once you're logged in, we're going to look for the relevant funding opportunity. You'll access the funding opportunity section using the menu on the left-hand side of the screen. And that gives you a list of everything we currently have open. For today's presentation, we're talking about Rural Community Health Opportunity, RCHIP. So you'll click into that funding opportunity. Something to keep in mind is we usually have a number of grant opportunities open at any given time. So this list can be a little long. So make sure you're grabbing the right one for this program. That's the opportunity ID 40398. So our Rural Community Health Opportunity is the one you're looking for. Once inside the opportunity, you'll click Start a New Application. Please note that although it says application, what you're actually starting here is your request for eligibility determination. This is the required first step before you can submit a full application. You can think of this as a gate. We'll use it to confirm you're eligible upfront, so you're not putting hours into a full proposal before we've confirmed you qualify. It should be a smaller lift than the full application, and it's there to save you time. Once you've clicked that Start Application button, or you're going to be actually filling out the RED. And this is a 5 steps stretch that we'll walk through now. The first thing to understand is that the RED isn't one single page. It's made up of a few separate components, and you'll see them listed out in the screenshot here. You'll click into each one to open it and work through it. You don't have to do them in order, so you can start wherever makes sense for you and come back to the rest at a later time. Inside each form, you'll work through the fields and fill them in. You'll notice that the forms use a lot of different data entry types. Some are short text box, some are drop downs, and some may ask you to upload a document. The main thing to watch out for is the red asterisk. Any field marked with a red asterisk is required, and you will not be able to submit your RED until every one of those is filled in. The fields that aren't marked required still matter though, so only leave a field blank if it genuinely doesn't apply to your organization. The more complete your answers are, the smoother the review of your RED will go. So we'll jump to on this slide. I just want to point out that on every page before you leave, there's a save button. So make sure you're using that save button. It saving keeps everything you've entered for later. It doesn't submit your application, it just holds your work. So you can save, close out, and come back another day and pick up right where you left off. Take as many sessions as you need to fill out your red, and remember that nothing is final until you actually click the orange submit application button at the very end of the process. Remember though, even though things are labeled as applications, what we're looking at right now is a red. It's not the full application. Okay, so this is a step I want you all to remember very clearly because it's the one people miss more than any other. On every single form after you've filled it out and click save, there's a orange mark as complete button. The system will not let you submit your red until every form is marked as complete. Marking a form complete doesn't lock it. You can still go back and make edits to it if you need to. So nothing is final just because you've marked it complete. The red is only final once every form shows marked as complete, and then you click the orange submit application button. If you ever find yourself stuck and unable to submit, this is almost always why. So come back to this step first to confirm all forms are marked as complete, and if you're having issues submitting. Okay, we made it to the finish line. The most important thing to know on this slide is that the submit application button won't show up until every component is marked as complete, as we kind of talked about in the slide before. So if you're hunting for that button and you don't see it, that's your sign that one of the forms still isn't marked as complete. Once they are all correctly marked as complete, you'll see a message in green above the list of components, and that will let you know that your application is in compliance and ready for submission. That green message is your green light. You'll now be able to click submit application. The status of the application will change to submitted, and our staff will then begin reviewing the red. After the red is submitted, you'll no longer be able to edit it. The CDFA staff will review your red to confirm you're eligible, and if you're approved, we'll invite you to come back and complete the full application within this same system. So keep an eye on your email for updates on the outcome of your request for eligibility determination, and that kind of completes the whole process. So in wrap up, you're getting registered, you're getting logged in, you're filling it out the red, marking everything as complete and submitting. We're here if you need us, and I'll pause now for any questions on our grants management system specifically.
Thanks, Nate. Appreciate that overview. I just want to raise a question that has been answered via typing, but I think it's probably relevant to a number of folks. Multiple people from an organization having their own accounts. How do those accounts get set up? Can you talk about making sure they individually register each of those folks and
Yeah,
who
for
maybe
sure.
those might be, like a grant writer and things like that?
Yeah, for sure. Grant writer is a great example. If an organization is using a grant writer, we would expect at least two registered users that have access to that grant. And those two users would be the grant writer themselves, so they can write the red for you. But we'd also expect to have an authorized official. So we defined that earlier in the presentation. Also should be registered because they're the person that should be submitting the application or the red at the very end. So both of those individuals should register for GMS individually. And when our staff sees those registrations, we'll make sure that those registrations get connected to the same organization and thus have access to the same application. So you all will be able to make edits to it collaboratively and submit a single application. So two different logins, but you'll be editing the same red in our system. Hope that helps.
Yes, absolutely. Thank you for that clarity. Those are all the questions I'm seeing around GMS for now. So I
Cool.
think at this point we're transitioning back to Rebecca to talk through what that process looks like as far as content.
Great. So Now we're going to shift to the actual form, the request for eligibility determination red form, what it is, what it asks for, and how to submit it. This section covers the content of the red, while you just heard Nate walk you through the GMS side that showed you how to navigate our system. So I really want you to think of the red form as your entry point to the program. This is not a full application. So like I just said, it's the required first step in the RCHIP application process. This is a concise, high-level overview of your proposed project, not a full application. CDFA will review the reds and make recommendations to Go North, who will give final approval. Two things to emphasize. First, I've mentioned this before, but I want to keep emphasizing this. The reds will be reviewed on a rolling basis. You do not have to wait until close to the September 1st application deadline. In fact, we really strongly encourage you to complete the red very early in the process, so you'll know if you're approved and you can proceed. Second, approval of the red does not guarantee funding. It just opens the door to submit a full application, which is where the competitive scoring will take place. Next slide. In terms of who can apply, the 4 budget period 1 priority entity types that we talked about earlier. So the federally qualified health centers and lookalike, community mental health centers, EMS providers, and county-run nursing homes and assisted living facilities are eligible to apply. And then childcare is also eligible when it's connected to one of those entities. So more broadly, eligible applicants can be nonprofits and municipalities from throughout New Hampshire. For-profit entities maybe can be considered, but only in very limited cases where there's absolutely no eligible nonprofit or municipality that can provide the proposed services. The project itself must directly support the rural health infrastructure improvements. So if you're still not sure whether your organization qualifies, the program guide, which is available on our resource hub, and I think it may be linked in this webinar chat, has detailed definitions for each entity type that you can refer back to. Next slide. So the red has 7 required sections. So general entity information, who you are, your entity type, contacts, and your authorized official that Nate spoke to. Project overview, we're just looking for a very brief executive summary of the proposed infrastructure improvements, project type and scope, what category of investment this is, and confirmation that it does involve minor renovations within an existing facility. Need and impact, the gap or challenge your project addresses and the expected outcomes. Alignment with program priorities, how your project connects to the first-year program goals. Project readiness, your current status and ability to move forward. And then a very preliminary budget, your estimated total project costs, the amount you're requesting from RCHIP, and if you are engaging any other funding sources outside of RCHIP, we'd like to know that too at this point. Next slide. So I should mention, sorry, that previous slide, those are all required sections. You have to complete them. But beyond the required sections, we have 3 optional components that we're asking you to consider. So the childcare section is for any organization whose project includes a childcare component. So you'll describe whether it's standalone or part of a broader project and who it will serve. The furniture, fixtures, and equipment, the FF&E section, is really informational only. Like I said, right now, CDFA can't support this work, but they're not eligible through our RCHIP funding. But we do ask that you describe those needs to us so we can work to connect you with other resources through the other Go North hubs. And finally, the technical assistance request, which I think is really one of the most important. All 3 are important, but it's where you can ask and request from CDFA for funded support for project development or grant writing. So if your organization would really benefit from professional help developing your project concept or preparing a competitive application, you should definitely flag it here. Next slide, I'm just going to review what is technical assistance in a little more detail. So CDFA provides what we call technical assistance to all of our prospective applicants. It's through webinars like this one, like I said before, and one-on-one support. In addition, we can provide financial support for project development and grant writing. So this should be requested through, like I just said, the technical assistance section of the red. If approved, you'll be able to work with a consultant from CDFA's list of pre-approved professionals, or you may procure one on your own, but you need to be sure that it follows competitive processes consistent with 2 CFR Part 200. This resource is designed for prospective applicants that have a strong project but maybe need help developing it or aligning their project for readiness, and or writing a competitive application. You may request both types of support. It's not one or the other, as we really want to help you put the best application forward possible. So actually, I think we're getting close to the end. Does anyone have questions at this time that we can answer? We are going to have time at the end for more questions too.
Yep, just a clarification of where can we find the NOFO RFP for this opportunity and what are the reporting requirements for these funds? So I would just say if you're talking about the red form, that's through our grants management system, as Rebecca and Nate have described. We did drop a link to the program guide as it exists today. But additional information on things like reporting requirements and scoring criteria for the broader application will be available at a future date. Is that fair to say?
Yes,
Rebecca?
that's very fair. We don't have any reporting attached to the eligibility determination. It's purely what it sounds like. We just want to know if your project might be eligible, and then we'll, whether or not you'll be able to move forward with a full application, which there will be reporting requirements attached to that, but we don't have that. We don't have that confirmed yet, and we weren't ready to share that out with everyone yet. So just focus on the eligibility determination piece for now.
Great. That looks to be the questions that we have open right now. So I think we can continue.
Great. So just really covering next steps here, things to remember, focus on. So your first concrete step is to get registered in GMS if you haven't already. So as Nate outlined earlier in the presentation, new users need to register. Please don't wait, because registration does require staff review and approval on our end, and it can take us a couple days to manage that process. Existing CDFA users can log in with your current credentials. If you have any trouble accessing your account, forgotten password, forgotten ID, we have resources linked, as Nate said, on our resource hub. You can also contact Felicity Winters. She's also listed on the slide for registration support. And then next step, so again, once you've registered and logged in, the red form will be available in GMS the week of June, so next week, June 15th. Remember that, again, I just want to keep emphasizing this, that reds are reviewed on a rolling basis and in coordination with Go North. So submitting early means you'll receive your eligibility determination earlier. And if approved, you'll just have more time to work on your full application before the September 1st deadline. It also opens the door to those technical assistance opportunities that I spoke to. But if you have any technical questions about completing the red itself, not, programmatic perspective, but just purely technical questions, we do encourage you to contact Justin Parker at the email listed on the slide. Okay, next slide, key dates. So let's just make sure, again, everyone has these dates. So June 11th is today. We're doing our program overview with the introduction to our red form. The week of June 15th, the red form will go live in GMS. June 25th, we will host another program overview webinar for anyone who wants a second look or just needs a refresher before maybe you've received approval by then on your red and you want to get started on the application, or you're thinking of getting started. June 30th, we will actually have our application process webinar, which will be focused on the full application and probably answer many of the questions that you've all had today. July 1st around July 1st, that full application will open in GMS. And like I said, applications are due September 1st by 4 p.m. I think we have reached the conclusion of our webinar. So if anyone has any more questions at this time, happy to answer them.
Thanks, Rebecca. I do
Yep.
want to flag a couple questions that have been asked and answered via text in the Q&A box. Just to note that if you are deemed eligible and then additional guidelines are released, can you choose not to apply? And noting that
Yes.
the answer is yes. So you can decide not to apply at any time. You could also apply, be awarded, and then decide not to accept the award if it's not going to fit within the parameters of your project. Um, there was also a question around the list of professionals to support pre-development and grant writing assistance. And Katie noted that those professionals that will be needs to be procured and will be available in July likely or in the next couple weeks. So
Yep.
we'll keep everybody
Great.
updated on that. There was just also a clarification of when does the red form close? And I know that you mentioned a couple times, but just emphasize the rolling availability of that form.
Yep. The red form does not close. So this is our structure. I think we may adjust it going forward depending on, this is kind of uh, this isn't our typical way of running our programs. I think with this determination letter or form being confirmed up front, but this is our plan for the 5 years, is to have organizations or entities be able to figure out whether or not they're even eligible for funding and then complete that form. So that form never closes. You don't, if you'd like to, I would imagine we'll see forms completed by entities who maybe aren't sure they really want to apply in budget period 1. Maybe they're more focused on budget period 2 or going forward. So we see these as just rolling opportunities to give that guidance as to whether or not you might be eligible. And we encourage you to submit them. It also helps us to know what projects might be in the pipeline. So if it's something, you're not eligible now, but as guidance changes over the years, you may be eligible for future years. So that's something to think about, and that it's actually helping to inform our processes too.
Great. There is a question about whether an organization might be considered a community mental health service provider. There's specific definitions and things around that, right, Rebecca? And I know
Yes.
that's in the program guide as well.
Yep.
So that's
It's in the
likely
program guide, and there is a link to a site where you can check your eligibility if your organization is listed. I believe it lists the federally qualified health centers, the community mental health centers. So if you're not on that list, you're likely not eligible at this point, but I encourage you to check.
There's also a question around whether grant writer assistance available for the red as well as the final application, and noting that the grant writing assistance is only for the full application.
Yes. Yep. We really like the red form is not hopefully overly complex form. So we're really hoping that organizations and entities are able to approach that within your own capacity. The application will have it'll be much more significant to complete. So I think utilizing grant writing services for that will be really important if grant writing is a capacity need that you have. But I don't think you should need it for the red. And yeah, our funding structure isn't set up that way, unfortunately.
Great. And then just another clarification on how that list of professionals that will be available via CDFA for pre-development and grant writing assistance, how that's going to be pulled together. And that is going to be through a public request for qualifications process. And if you go to our main website, we actually have a RFQ page under the About Us section. So that will be available soon. So please, you can check that page at any time to see any open RFQs that CDFA might have related to these resources. I also just want to note another question around whether FAQs will be released from this webinar. And we will plan to publish FAQs as we accumulate questions and answer them throughout this process. So we will have that resource available as we are able to gather these questions and provide those answers to folks. see. There's a question around whether there will be a cost share with our chip and KDAC. You're typing in answer, so I wonder if you want to come on screen and answer that for us. Oh, she noted, sorry, cost share be no required match. I did not understand that.
There's not a cost share or a match requirement with these funds.
Great. I'm looking at the time. It's a little after 3. We've got a couple other questions coming in. If we complete the red and our project is not eligible for year 1 funding, will we be eligible to resubmit for future years?
Yes, I think, like we said, the guidance for this program is going to change probably, I think, every year. So yes, if you're not eligible in 1 year, you are denied, I think, and guidance changes, then you should plan to complete an eligibility to form at that time to see if maybe you're now in a position where you could apply.
And I'm not sure if the question in the chat is asking the question of leased space, but I'll just answer that. So if you are in leased space, if you have a long-term lease, you will likely be eligible to make improvements in that long-term leased space with the
Great. Well, thank you all very much for your thoughtful engagement throughout today's webinar this afternoon. We really appreciate you taking the time to learn more about our program. As we mentioned at the top of the presentation, we will be sharing our PowerPoint slides along with a recording of today's webinar and relevant materials with all of you and all of those that have registered to join us this afternoon. So thank you again, and we hope you have a great day.